Next trip.
Natural sunscreen.
This is Laurel. She's our patient this morning. Dr. Stephen Mulholland, 25 minutes.
Yeah, hair removal is still the number one thing that we do with lasers, and high speed and efficacious. So this is the Vectus laser, and we can do the whole leg in about 4 minutes. Very simple to do. And so with these new products, large spot size, high repetition rate, and it works. And so we simply point and shoot, large spot size with the Vectus, and we're targeting dark hairs.
Yeah, they have to be dark hairs. Blonde hairs, gray hairs, it's not going to work. That's when you do have to get electrolysis.
Absolutely right. And so we can do with this, with the Vectus, we can do the entire body, lip, chin, armpit, bikini, and leg, or a man's chest and back in about 20 minutes.
Okay, so this is one treatment. You're going to have to get another treatment,
so
or maybe even another
It's usually a series of 4 or 5 sessions.
Not bad at all.
And it's about, whenever you see the hair grow, so every 6 to 8 weeks. After that, we can usually kill about 80% of the hair.
Wow.
80% of the hair. And we will mix up machines. So if, let's say the Vectus is as optimal permanent reduction after 2 or 3 treatments, but there's some resistant hair, we'll switch to another machine, which has another wavelength. So the secret is multiple wavelengths, high speed, painless. Did that hurt, Laurel?
Not at all.
So customers don't like to have a lot of pain. Patients don't want pain, but they want outcome. So we've gotten very good with lasers at killing hair with less pain, and we're still up to about 80%. So if you look at these types of individuals, that man's back was done in about 6 minutes, and he came 8 times between 2 different types of lasers. He'll never have to shave or wax his back again.
You're going to have a lot of ladies calling today going, "Hi, Dr. Mulholland, I'd like to make an appointment for my husband."
Well, man's chest and back is about 25% of our patients are men now, believe that or not. Is most men, you know, if they have a lot of hair on the chest and the back, they'll go through a lot of dress shirts, and it can be sometimes socially embarrassing. So
yes, exactly. And I know that there's an upkeep program, and you might have to come a couple of times a year just for the upkeep, for the little bit of hair that might grow back over the years.
We call it our hair removal club. Once you've done your 5 treatments and you've got 80% of your hair gone, you can come as often as you want for any kind of maintenance treatment.
It's a club at SpaMedica. Yes. I love it. Laurel, thank you so much, and I love the blue hair.
Well, thank you.
Adorable. I love it. Okay, heading back to the station. More non-invasive, non-surgical treatments when we come back here with Dr. Stephen Mulholland, SpaMedica. 4 minutes for the legs.
Still to come, hair today, gone tomorrow. Coming up in Family Health, we're going to examine the issue of hair removal. What works, what it costs, and how much it's going to hurt. Welcome back. Well, this is the time of the year when we show a little extra skin. And many people are a bit more concerned about getting rid of unwanted hair.
So what's your best bet? Shaving, waxing, laser, hair removal. Our health specialist, Beatrice Politi, takes a look at the brand new treatment, plus some of the old standbys. Good evening, Beatrice.
Good evening, Ann and Leslie. There's a few factors to consider: price, pain level, and effectiveness.
Parvane Siddiqui still waxes her arms, but not her legs. She's found something else.
Recently, I decided to do the laser, which is, I am very happy, and is freedom.
Crystal Field used to wax as well, but found it was time-consuming. Laser has worked for her, except for this one problem.
I wouldn't use the term painful, but it was uncomfortable.
Now there's a new laser machine on the market that promises to take away the pain and remove hair faster. This is the old version, the Light Shear Duo, and this is the new Light Shear Duet.
You've got 5 times the surface area for each pulse. It also has a chamber, so when I place it on the skin, it sucks the skin up, and that alters the characteristics of the blood flow and the nerve sensation.
Which means less ouch, a big plus for Stéphane Pernu.
So waxing was painful. I tried lasers, and I found them to be pretty painful.
This is the first time Field and Pernu are trying out the new technology.
After 5 treatments on the Light Shear Duet, about 75% of hair doesn't grow back. And for the average small zone, bikini, armpit, chin, sideburn for a woman, you're looking at those 5 treatments are going to cost you less than $1,000.
But in the short term, more than shaving and more than 5 waxes. Things you have to keep doing to keep the hair away. One hitch with lasers, you need dark pigment in your hair.
Other disadvantages: if you are gray, blonde, or white-haired, you're out of luck. We need a target. We need a color for that hair laser wavelength to be attracted to.
So is the pain-free claim really true?
It's much gentler. I don't feel the snap that I used to feel with the light shear.
You know, there's odd times, you know, a snap, you know, like a mosquito bite, but it just feels like a warm massage.
If you're thinking about the laser system for your legs, it's probably closer to about $2,000 for roughly 6 treatments. As for waxing, the cost for a full leg is about $60 a session. So you can do the math with that. Over a lifetime, the waxing might actually be more expensive than getting the laser done if it indeed takes away 80%
Take out
of the
a
hair.
mortgage.
Yeah, it's true. It's because it's a lot of money to lay it up front, right? It's $60 at a time with waxing. You probably don't think about it that much, but depends on where you're at.
You know, I think if you're a woman with a lot of hair, and sometimes it can be very discomforting how much hair you have. The laser treatments are amazing.
And great for the guys, too.
Yeah,
it's true.
All I keep seeing is Steve Carell and the 40-year-old yelling Kelly Clarkson.
If that screech wasn't enough to put you off waxing, I don't know.
I'm sorry, I digress.
Hey guys, good morning. You know, I was talking to Kevin not too long ago, and I said, how much money would you pay to never have to shave again? I think he said $5 million. $5 million that he doesn't have. But Dr. Stephen Mulholland, I was actually talking to you about men's hair removal on the face. Can that be done?
Yeah, men get irritation under their neckline when they shave, or they have to shave up close to their eyelids.
Yes.
If you have that kind of hair, most men want that reduced, and laser hair removal, especially these new technologies, very good for that.
So you can reduce it.
Permanently reduce it, yeah, absolutely. And then for men, backs and upper chest.
Right over there?
Yeah, a man's back.
Yeah.
And women, facial hair and leg hair and bikini hair, very, very common.
Okay, so I know that, I don't know if this is still true, when you have light hair, that's really hard to remove.
Yeah, light hair, gray, blonde, and red hair, much more difficult because it attacks the pigment.
But can you do it?
Not very effectively. Usually that's going to be waxing and electrolysis.
All right.
But if you have white skin or dark skin and dark hair, these products are made for that.
Okay, so Laurel is here. Thank you so much for coming in today, Laurel. What are we doing on Laurel's
What you
leg?
see here, this is called the diolaze. This is the newest generation of hair removal because, you know, hair removal to be effective, it usually has to hurt. So we use numbing cream and other techniques. This is a scanned device that is very fast but extremely cold. It cools the skin, so you don't need numbing cream, almost painless. So I'll show how it works. It's basically the diolaze is a scanned diode. Sort of very quickly you can treat the entire lower leg in about 8 minutes.
Wow.
Very fast. And because it's so cold, a woman doesn't feel pain. So it's removed that pain
Laurel?
factor.
Nope. No pain.
Now if we look up to the screen here, you can see that's the image of her leg, an infrared image. And in the other treatment is white hot. You can see how it's almost blue to black cold. We basically created an ice cube while we're treating because it's so cold, and then you don't feel the discomfort of the hair reduction.
Wow.
So very fast.
So you're doing this treatment, how many more treatments?
So generally do 1 treatment about every month. You might do 5 treatments. The average result is about 85% permanent reduction after 5 treatments.
Okay, how much is this going to cost? I haven't talked to you about prices yet, but approximately how much could this cost? Like a range?
Right, a range. Like most things, like that facial thing we did or this hair reduction. When it's a laser treatment in a doctor's overseen environment, usually you're going to spend between $250 to maybe $500 a treatment, and you might do it once every month to 6 weeks. So at the end of that 5 treatments, it might cost you upwards of $1,500 to $2,000, but you're not doing waxing, you're not shaving, there's no depilatories, you don't have to worry about the bumps and lumps in your bikini area, and you're hair free for the rest of your life.
Yeah, because I'm going to have a bikini on very soon, Dr. Mulholland.
Well, thank God you're starting now then.
Thank goodness, thank goodness. Okay, well, we're hanging out with Dr. Stephen Mulholland at SpaMedica, and what are we doing next?
We're going to remove tattoos.
We're removing tattoos when we come back. It's a new way, something you've never seen before. We're going to head back to